coming up.
Sunshine Earth Labs, Canadian-based bioscience company, announced in March of 2023 that they received an amendment to its controlled drug and substances dealer license to legally possess, produce, sell, and distribute opium, morphine, and heroin. On January 12, 2023, it received a similar amendment for the sale of cocaine in November of 2022. Is that true?
So how is it allowed to legally operate if there has not been an exemption given?
Because safe consumption sites are part of healthcare. Harm reduction is healthcare. I may feel I need to remind the member of that.
I would also remind the minister that its words matter and it is not safe, it is supervised.
This guy's garage. Like and subscribe.
Thanks very much, Chair, and thanks, Minister, for being here once again. A question, did we hear testimony in this committee that the Deputy Chief of the Vancouver Police has testified that 50% of the dilaudid seized is diverted from so-called safe supply?
I'm familiar with the testimony of Fiona Wilson. However, she did state that we strongly support the notion of not trying to wrest ourselves out of this crisis. She also referred to the importance of having a system where...
Thanks very much, Minister. In November 2021, is it true that fair-priced pharma imported 15 kilograms of heroin into British Columbia?
It seems that the member is out of date with his facts. Fair Price Pharma then removed that tweet and had discussions with Health Canada verifying that they did not.
So are you suggesting, Minister, that there is no heroin imported legally into this country?
Heroin is imported legally into this country under strict licensing and permit regimes.
So, okay, well, whatever. Sunshine Earth Labs, Canadian-based bioscience company, announced in March of 2023 that they received an amendment to its controlled drug and substances dealer license to legally possess, produce, sell, and distribute opium, morphine, and heroin. On January 12, 2023, it received a similar amendment for the sale of cocaine in November of 2022. Is that true?
I would have to refer to our officials on that, but I will emphasize that any company in this country that has a license is for medical use and research purposes. Minister, that's fine. If you don't know the answer, just please get some. You know we have short time. Just find someone who can answer it. Is there anybody back there that can answer? Point of order, Mr. Chair.
Yes, go ahead, Minister. Yes.
I think the framing of what companies do when they do have licenses to import controlled substances is important for the record.
I tend to agree with you, but the time for this exchange is complete. I expect that perhaps one of the other questioners will allow you to come back to that topic. Go ahead,
And I will
Dr.
defer
Ellis.
to the experts to answer Dr.
Thanks very
Ellis's
much.
question.
You know, I guess all we get from this committee from the ministers is non-answers. If there's nobody down there that can answer a question, why do they even agree to come?
I will defer to one of our health committee officials to answer the specific question on that license.
I asked you a very specific question. Anybody down there can answer it.
I think we would have to get back to the member on his question with respect to the specific company information that he's looking for. We don't have it on hand.
Great. Certainly table it with the committee. We'd appreciate that. Is it also true that Safe Supply Streaming Company announced on January 30th, 2024, that they underwent an official inspection by Health Canada for the acquisition of a dealer license? Yes or no?
I defer to officials who met with them.
And so, Minister, you're confirming that your officials have met with this company having a dealer's license for opium, morphine, heroin, cocaine?
Confirm that they will answer your question.
So have they met with this company?
Again, Mr. Chair, I think with respect to specific meetings with specific companies, we'd be happy to get back to the member with the details, but we don't have them on hand.
It's interesting that the website of Safe Supply Streaming Company talks about a market of $360 billion in legal narcotics, including cocaine. Minister, it seems interesting that now we have companies in Canada getting licenses to, as I said, possess, produce, sell, and distribute opium, morphine, heroin, and cocaine, all under your Liberal government's idea of legalization. Is that true?
Mr. Chair, all of the narcotics listed by Dr. Ellis are legal and restricted are under strict regulations. They're also used for medical purposes in hospitals and also in research settings.
Interesting. So what I said specifically, Minister, is that they can legally possess, produce, sell, and distribute these drugs. Is that true?
Clearly, Dr. Ellis isn't interested in the importance of research science and medical treatment use of these highly regulated narcotics.
Excellent. So what you're telling me is that these drugs will never be legal to be used outside of research settings in our country. Is that true?
That is correct.
And oddly enough, it's stated that the Health Canada license are for research purposes only, as you have attempted to say. But the CEO of Sunshine Labs says since inception, we have been proactively pursuing amendments to our dealer's license to include MDMA, coca leaf, cocaine, opium, morphine, and heroin to position ourselves as a legitimate, safer supply partner. Have you or your officials had meetings with this company?
Jen Sachs can answer with regards to meetings.
So we have met with Sunshine Labs. Sunshine Labs is a licensed dealer. They did publish misinformation. We did follow up last spring when that misinformation was published in terms of selling to the public. They are not authorized to sell to the public, but licensed dealers can conduct certain activities with controlled substances for medical and for research purposes, depending on the substance and depending on their license.
Don't you think on behalf of Canadians it's very concerning that a former medical officer of health in BC set up a company to import heroin into this country, and now the current Minister of Health there, with your cooperation, Minister, is attempting to legalize other substances in this country. Is that not concerning to you? Should Canadians be concerned about that? I know I am.
I think it's important that we address the facts with regards to Fair Price Pharma and not speculation. Dr. Perry is an esteemed and well-respected physician. Fair Price Pharma is an early-stage company looking at research potential in addressing substance use and addiction, and consults with Health Canada on what are the proper channels and regulatory bodies.
Thank you, Dr. Ellis.
You know that it's illegal for people to have personal use of or even have illicit substances on them in Canada, everywhere east of the Rockies. You're aware that is the case right now?
Yes, I'm aware.
Okay, so that being said, it's a criminal issue in this country. Would you not agree?
I would say that at this point in time, decriminalization is only available as in British Columbia to refer people to health services.
Okay, so you agree that it's a health issue. Your government, the Privy Council, went out and did polling to see whether the Canadian public supported decriminalization. Polling was mixed. If the polling was really high in support of decriminalization, would your government gone ahead and moved decriminalization sweepingly across Canada?
First of all, thank you for the question, and I want to thank the member for his advocacy. As I've said, both in this committee and in the House, as we move to address this health crisis, we also have to make sure that we have all tools in place, both from a public health and public safety lens, which means that we have to ensure that full wraparound health services are in place as we move forward with other tools such as decriminalization.
Minister, I can't think of another health issue where the government's going out and doing polling, whether it be heart disease, liver disease, what decisions they're going to make, how they're going to maneuver around health. Can you think of one?
The Privy Council office does polling on a myriad of issues.
Has the Privy Council done polling of the 42,000 families that lost loved ones, and whether they should ramp up and scale up a safer supply of substances to replace the toxic drug supply?
I can't speak to if such specific polling was done, but what I will say is that I meet with families across the country constantly, unlike the opposition who refuses to meet with families, including Mom Stop the Harm.
Alors, Madame la Ministre, tout récemment...
So, Madam Minister, very recently, a supervised injection site opened its doors in the Saint-Henri sector of Montreal, right near a school and a childcare center. Children have to make special efforts to step over, use syringes and avoid drug users. As my colleague Gérard Deltel put questions to you about this. I'll point out that your answer was you were unaware of this site. So what can we tell parents who are rightly worried about this?
Through you, Mr. Chair, I'll thank the member for her question. And the member should know that this is a provincial safe consumption site that was authorized and is regulated and operated by the province. In my own perspective, and certainly as a mother and as minister, as I've said repeatedly, and I say here now, public health and public safety are a priority in addressing the overdose crisis. However, in doing so, we also have to meet people where they're at in community to have accessible health care, which this is what safe consumption sites are.
Madame. Alors, la site de consommation sur...
Thank you, Madam. So the Benoit Lobre safe consumption site, this is what I asked a question about, we've seen is not on the website of Health Canada as being an approved site. So has it not been approved? Is it under the open application section that it's been approved of?
Yes.
So effectively, there are these injection sites that require to have an exemption under Section 56.1 of the Controlled Drugs and Substances Act. And it can have an open application with Health Canada, not be approved by Health Canada, and be allowed to operate. Is that correct?
As I stated, this site is operated and was authorized under provincial jurisdiction.
Has an exemption been given to La Maison Benoit Lobre?
I believe the member answered her own question when she referred to the website.
So how is it allowed to legally operate if there has not been an exemption given?
Because safe consumption sites are part of healthcare. Harm reduction is healthcare. I may feel I need to remind the member of that.
I would also remind the minister that it's words matter and it is not safe, it is supervised. Her own website actually even says supervised. So we're effectively, there are injection sites that are operating that do not have the legally required exemptions through the Controlled Drugs and Substances Act, and you're completely A-OK with this.
Through you, Mr. Chair, I thank the member for her question and will remind her that from the healthcare lens that we are operating in, harm reduction is a key pillar of healthcare service provision, which does include safe consumption sites and overdose crisis sites. That being said, with regards to her specific question on this site, I will defer to officials.
Thanks very much. I'll just clarify that for the exemptions, there's individual site-specific supervised consumption sites that can be authorized under subsection 56.1, as you noted. There are also class exemptions that have been provided to each province and territory to be able to authorize urgent public health needs under their own authority. And so Health Canada has issued a class exemption to provinces and territories, Quebec included, and it is under that class exemption that the current supervised consumption site or overdose prevention site that you're referring to is operating.
Okay, so the City of Montreal made a request to go towards the British Columbia model. Has that been rejected?
I believe the Mayor of Montreal was very clear in her public media statements that there is no such request at Health Canada.
So how many applications are into Health Canada to adopt a BC-like model of legalization of hard drugs that are currently sitting with your department?
I'll ask an official to answer that, but as to my knowledge, there are none. Do you want to say that is correct?
That's correct. Yeah, there are none.
So there are currently no applications whatsoever that have been received by Health Canada. And will you commit now to rejecting any future applications that will go forward?
I don't deal with hypotheticals. I address each community and its requests in addressing the overdose crisis in their communities and their knowledge and understanding of what they deem is best. Then we trust evidence, science, expertise, and healthcare service provision.
I'm going to move a motion that I put on notice on Friday, June 14th, that given the large workload the committee has on its docket, the committee instructs the chair to book 5 meetings between July 8th, 2024 and September 13th, 2024 to deal with unfinished business and pressing matters facing Canadians, notably doctor shortages and the addiction crisis. Mr. Chair, we have been hearing very clearly very serious concerns, and so as such, I think that it is incumbent on each and every one of us to roll up our sleeves and get to work for Canadians, as that's exactly what they expect.
I disagree with the motion. And furthermore, given the time of day, I have to say I will try again. Motion to adjourn.
To adjourn the meeting or moving to adjourn debate on the motion?
Adjourn motion. Adjourn the motion. Adjourn debate on the motion.
Okay. All right. So that needs to go straight to a vote, non-debatable.
We have a recorded
motion.
division, please, Chair.
Recorded division on the motion to adjourn debate on the motion.
Motion to adjourn debate on the motion. Dr. Hanley.
Support.
Madame Kayabega.
Pour?
Madame Brière.
Oui.
Dr. Blowski.
For.
Ms. Sidhu.
Yes.
Dr. Ellis.
Against.
Mr. Patzer.
No.
Ms. Goodridge.
No.
Dr. Kitchen.
No.
Monsieur Terriot.
Oui.
Mr. Johns.
Yes.
7 yeas, 4 nays.
All right. So the debate on the motion is terminated.